Good afternoon, everyone. KeyReply is a market-proven AI orchestrator for healthcare providers. So what we do is that we help healthcare providers save costs and increase patient throughput. We help them reduce their costs by more than 90% and at the same time increase revenues by getting more patients through the door. And how we do that is that we help to do automation of patient workflows and interactions when they're out of the hospital inpatient setting. For example, we do patient post-discharge support, patient intake, patient education, and scheduling. We are already a market-proven product, so we are in 2/3 of all hospitals in the Singapore market, as well as in 8 countries such as Australia and in the UK. We currently already power 12 million conversations a year, as well as 400,000 calls. CIOs, CTOs love working with us because we are not just a siloed point solution. In fact, we work really well across the whole organization for clinical and non-clinical use cases, and we scale really quickly. Among us, we have more than 30 years of health experience with 3 company exits. So for myself, this is my 3rd company, and I once had to turn around a bankrupt company, and the only way I did that to turn around it is because I did automation and tech, which is why I believe so strongly in the things that we do. We are looking for investors to join us in our round of pre-seed funding of 5 million, which is almost fully subscribed. Well, seeing is believing, so what I'd like to do is to invite my co-presenter, which is our AI agent over here, who will join us in doing cardiology post-discharge care. Let's invite him.
I'm Nick, your care coordinator. I'm calling to follow up on your recent hospital stay at Heart Care Hospital and ensure you're recovering well. Is now a good time to talk?
Yeah, sure, go ahead.
Perfect, thanks. First, for privacy, could you confirm your date of birth and the reason for your recent hospital stay?
Well, 1st of Jan 1980, I had a heart stent put in.
Great, thanks for confirming that. Are you comfortable discussing your recovery with me now?
Go ahead, go ahead.
Awesome, thanks Mr. Johnson. First, how have you been feeling since your discharge? Any challenges or concerns so far?
Well, I had good days and bad days. Today's pretty good.
Glad to hear today's on the good side. Next, on a scale of 1 to 10, how would you rate your overall health today compared to before your hospital stay? And are there any specific challenges you've noticed during recovery?
Well, today the sun is out. I feel pretty good, like a 9, but yesterday felt like a 2.
That's quite the swing. Sometimes recovery feels like a roller coaster. Sunny days, then the occasional dip. Just to be safe, have you had any chest pain, shortness of breath, or swelling in your legs or feet, especially on those 2 out of 10 days?
Yeah, fortunately not that much, but yesterday I felt like I had elephant legs.
Oh, the old elephant legs feeling. Never a crowd favourite. Swelling like that can happen after a heart procedure, but it's something we want to keep an eye on. Have you also noticed any dizziness, fatigue, or irregular heartbeats, especially on those tougher days? And have you been able to check your weight or blood pressure at home for any unusual changes?
Fortunately not that much, but I could lose a couple of pounds.
Hey, you and me both. If weight loss were as easy as flipping a switch, we'd all be models, right? No worries. Just try to keep an eye on your weight and blood pressure if you can, since sudden change.
Well, I will let him take a break. Come talk to us to experience it yourself and find out why customers really love working with us. Thank you.